Hi, friends, and welcome to the Dr. Green Mom Unfiltered podcast. This is your host, Dr. Ashley Mayer. I feel so honored to have this opportunity to support you and your family on your parenthood journey. Just a note before we begin, if you enjoy this podcast and would like to support my work, please consider subscribing at drgreenmomvip.com. Subscribers have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. As always, I appreciate your support. And now let's begin. Oh my gosh!
We are back.
Welcome back. Dr. Lydia and Dr. Mayer are here.
Hi.
We have an amazing topic today for all of you who are riddled with vitamin K at birth. This is very near and dear to both Dr. Lydia and I. One, because every other country in the world, Dr. Lydia offers an oral dose in lieu of the injection at birth, except for the United States. So the FDA, there is no FDA approved vitamin K at birth. And so several years ago, I set out to make that happen here in the United States for parents. And so I formulated an oral vitamin K for birth, and it is USDA organic and non-GMO verified. And we are going to talk all about those differences today. So we're going to talk about why vitamin K? What is vitamin K? Why do we need it at birth or don't? You know, some parents choose to opt out of it. And I want to give you options. So here at Dr. Green Mom, we're all about giving options to parents, okay? Especially when the research shows that other options are just as beautiful. So that's what Dr. Lydia and I are going to talk about today, all about vitamin K.
Yeah, we get a lot of questions about it too, because I think parents, anytime you're injecting something into a babe who is very new on the scene, parents are nervous, have questions. What are you doing to my child? Do they really need this? How important is vitamin K? How come they don't have this already? Can't they get this from my breast milk? There's a lot of questions, and rightfully so. So we're going to dive into that today. Yeah.
Yes, and I think one of the main reasons that I wanted to do this podcast with you today, Dr. Lydia, is because there's a lot of misinformation.
Oh, God, yes.
That on vitamin K at birth. And so we want to give you research-backed information today, and we want to kind of talk about a lot of that misinformation as well. And we'll do that on the back half of this podcast. And so, let's dive right in, Dr. Lydia. You want to chat about what is vitamin K1? Or vitamin K in general?
Yeah. So we have two types of vitamin K, vitamin K1 and vitamin K2. And today we're primarily talking about vitamin K1, phyloquinone. And this is a fat-soluble vitamin, which means your body can store it. And that becomes important later on. And the main function of this vitamin is to make platelets sticky so that you can clot properly.
Correct.
And obviously the clotting cascade, you don't want to be over-clotting, but under-clotting can be quite dangerous for our babies. So it's important to take this topic seriously. And if you're opting out of vitamin K, to know what you're opting out of, potentially. So vitamin K, actually somebody won the Nobel Prize for discovering vitamin K back in the 1940s because it was such a big deal. Right, yeah. And isolating it so that we can use it, whether it's an oral form or an injectable form. Yeah.
Yeah, he started out with baby chicks. Right?
Yes.
Yeah. So that he was doing his research on baby chicks. And so just as an aside, quick to note, if your child gets a cut and you see that the blood starts to coagulate and kiddo stops bleeding, that is the vitamin K cascade at work. So that is your vitamin K working. So and to put it in, easy terms, not vitamin K at birth, but just putting it in easy terms is a cut when it stops bleeding. That is your vitamin K at work.
Exactly. Yes. Well said.
Yeah. Okay. So There are two types, right, Dr. Lydia? Vitamin K1 and vitamin K2. Do you want to quickly chat about the differences between vitamin K1 and vitamin K2? Because parents get this confused because they think they can give vitamin K2 at birth, like an oral dosing regimen. And what we specifically want you to be taking is vitamin K1, the dosing regimen, if you choose to do oral. So there's a lot of questions about the difference between vitamin K1 and vitamin K2.
Yeah, without going down the rabbit hole too much, vitamin K1 you need for clotting, and vitamin K2, well, it has a small role in clotting. It's primarily used to get calcium where it needs to go, into the bone, into various tissues, hopefully not your blood vessels, sort of thing. It basically acts like air traffic control for calcium. Vitamin K2 you can make in your gut using gut bacteria. Vitamin K1 is not synthesized in the gut, as far as I know. It is green leafy veg, mainly dietary sources.
So that's one thing that I want you all to know right away in this podcast is that vitamin K1 is not made in the body. So you get that from food sources. Vitamin K2, your body is born with a sterile gut. And over time, that gut is populated and vitamin K2 will start being made in your baby's gut. But just to note, because we are going to talk about this in depth, vitamin K1 comes from your diet for the very most part.
Yes.
So we have here in the show notes about the clotting with vitamin K1 and prothrombin. So do you want to quickly chat about vitamin K1 and prothrombin?
Yeah, let's talk about this. Partly because I was on YouTube Shorts today, scrolling through vitamin K stuff, and I got frightened because there's some misinformation out there that could be quite misleading. And again, we'll dive into it, but the consequences, are potentially severe. So I don't want people to be confused about this. So there's a little protein called prothrombin, and it makes your platelets sticky once it's activated. So that's what creates this kind of matrix that will create a clot, like Dr. Mayer said, when you get a cut or something of that nature. So prothrombin rises between days 3 and day 7. So at that time, your baby has prothrombin, but it needs vitamin K1 to become active. So that is the issue. It's not that your body doesn't have this little molecule that helps with clotting. It's that it's not working. It's not active. And if it's not active, it's not helpful. So it takes about 6 weeks to reach really adult levels in terms of its function. So I think that's important for people to understand.
Yes. And I'm going to go in and talk. I'm just going to say now, like we were going to talk about some of this later in the podcast, but for many of you listening to this, there is information out there, and I see it all the time, that don't worry about doing vitamin K at birth because your baby's vitamin K comes in on the 8th day. So this is what we are trying to explain to you. Back in 1941, there was a study that was done, and this information got extrapolated that because prothrombin peaked around day 7, that means that vitamin K, like we just started talking about how vitamin K comes in on day 8. This is for biblical reasons. But the actual information was extrapolated from prothrombin. So just because babe has prothrombin peaking on day 7 does not mean that it's been activated to make sticky. So vitamin K is still vitally necessary. Your vitamin K does not come in on day 8 miraculously because vitamin K1 is from food. So you're getting a little bit from breast milk transfer or from formula from day 1 after birth. But vitamin K2 is still trying to populate, and it'll take a long time to populate that gut. So no, vitamin K does not come in on day 8. This came from prothrombin peaking around day 7. That does not mean that this activates this cascade of clotting quite yet. So there you go. I want to make this information widely available because it's too widely used in social media. Oh my gosh, vitamin K comes in on the 8th day. Don't even worry about it. That's when you can circumcise. A rabbi will circumcise on day 8 because your vitamin K comes in. That's just simply not true. A rabbi will circumcise on day 8 for biblical reasons. And so, yes, if you do want to circumcise on day 8 with a rabbi for biblical reasons, you'll have to go that route. But that's not to say that your baby is protected from delayed onset bleeding, which is why we give vitamin K1 at birth, either injection here in the United States or oral in most other countries in the world. Whew, got that off.
I think it's great that you brought up the formula feeding and the breast milk feeding, because I found this kind of surprising, but breast milk is not a great source of vitamin K1. It's a great source of pretty much everything else that you can possibly imagine, but it's our formula-fed babies actually have sufficient vitamin K1 earlier because the formula is just
it has vitamin K1.
Yes, very intelligently. But the breast milk does not, and it's still a bit of a mystery to me why that's not the case.
So yes, so Dr. Lydia her and I want to preface this as well. We are still, both of us, as much as we've researched over the years, vitamin K, it is still a quandary to us why babes don't have vitamin K1 at birth. There's a reason, and we're going to talk about that here in a little bit. But they're all hypotheses. So we do still wonder, well, aren't babes made perfectly the way they're supposed to? And isn't there a reason why there's not high levels of vitamin K1? But we also know from history, babes who have suffered from what used to be hemorrhagic disease of the newborn and is now vitamin K deficiency bleeding. So there are babes who pass away due to this. And so we want to say that we are just as interested in that answer, but what we're here to do is limit your baby's possibility for vitamin K deficiency bleeding. So that's our job as doctors, is to make sure that that does not happen to your baby. And we don't want you to be one of the 100 or one of the 100,000, depending on what type of delayed bleeding. We want to be 100% sure that your babe is not going to suffer. That's our job as doctors, right?
Yes.
Okay, we'll just lead right into it. Like, it's in our show notes. Why is vitamin K low in babies? And shouldn't nature provide everything they need? Right, Dr. Lydia?
Yeah, there must be some trade-off that's happening here. There can be microtraumas through the birth process. So I think we discussed maybe the body doesn't want too many clot situations happening as that microtrauma is taking place. You had an interesting comment about stem cell delivery.
Yeah, so one of the hypotheses is during delivery, there's microtraumas. So when baby's going through the birth canal, there are microtraumas that happen. And I mean, you're squeezing what we call a bowling ball out of our vagina. And it's all of that compression that's happening, which for other reasons we think is super beneficial. But for the reasons of bleeding, there's a lot of microtraumas that happen during the birth process. And one of the hypotheses that I read about was, stem cell delivery has to get to these microtraumas in the body. And if we're clotting these, if we're giving vitamin K1 at birth, the stem cells may not be able to get to these areas of microtraumas to do these repairs. And so that was one hypothesis that I read about. I can't find any research to back that up. So I do want to say this is simply a hypothesis. And I loved what you said about vitamin K2 and gut colonization back in the day.
Yeah, so vitamin K2, at this point, we don't use it very much for clotting, but it can activate some of the same proteins that vitamin K1 can. And let's be honest, for the vast majority of history, humans were not giving birth in a sterile environment at all. So the baby's gut would have been colonized immediately with who knows what, right?
And vitamin K2.
Yes, as well. So I think there was a greater source of vitamin K2 potentially earlier on in the baby's life, which could have assisted with clotting and maybe prevented some of this. We also know that infant mortality rates were much, much higher than they used to be. So I'm sure there were still babies that succumbed to the vitamin K deficiency bleeding. But I do think there's a potential for vitamin K2 to have had a larger role.
Yeah, back in the non-sterile days. Now, we pretty much birth in a very sterile environment. So most births are happening in a hospital and very sterile. And so over the time of evolution, K2 just may not be what it used to be in the gut, may not colonize as fast. And that's just another hypothesis. So Dr. Lydia and I love throwing this stuff around and, see if it sticks to us in a research plausibility. Yeah. Okay, so we did talk about the difference between vitamin K1 and K2.
I think we should dive into the vitamin K deficiency bleeding and talk about what that is.
So the whole point of vitamin K1 at birth is to prevent vitamin K deficiency bleeding, which once was called hemorrhagic disease of the newborn, which I kind of liked that name better because it says vitamin K deficiency bleeding. We're not necessarily deficient at birth. So I just personally don't like vitamin K deficiency bleeding. Not that I liked it. It sounded more clear to me, hemorrhagic disease in the newborn, because it was, that's what it was. So that's just my 2 cents. But let's talk about what that is. So what are we trying to prevent by offering the vitamin K shot at birth?
Yeah, so I think oftentimes when we think about our little children bleeding, we think about cuts and scrapes and external bleeding that we can see. But VKDB for short is concerning because it's bleeding that's happening internally. So it could be in the digestive tract. You could notice bruising in the head and face around the eyes. It could be from the umbilical stump or if you had a circumcision procedure. But the most significant and concerning with the highest consequences are a brain bleed. And that can lead to permanent damage and or death potentially. So.
Okay, so there's 3 kinds of vitamin K deficiency bleeding, and we'll call it VKDB for short. There's 3 types. And so vitamin K1 shot given at birth, or if you do the oral regimen, either of those prevents these 3. So do you want to chat about those, Dr. Lydia?
Sure. So there's early VKDB, which happens within 24 hours. And usually that is more linked to the mother being on certain medications, which I can dive into. There's anti-seizure medications and warfarin that can cause some differences with clotting. So that one is more rare. And I think a lot of doctors would be quite aware that the woman's on these medications and be taking kind of the precautions that they need to be. The classic VKDB is within days 2 to 7, so in that first week. And this is kind of GI bleeds, gastrointestinal bleeding, tummy bleeding, or with the umbilical cord. And it's more common in breastfed babies. As we discussed, breast milk is naturally low in vitamin K1. And then we have our late VKDB. And I will say this is probably the one that is more dangerous. You're home with your baby, and it can have serious consequences. We'll just be honest about that. So it's between 2 weeks to 6 months, kind of in there. And your baby will present with potentially bruising in the face, vomiting blood, and severe failure to thrive. Like you will know something is wrong with your child.
Seizures,
yes.
Yeah, they'll go from completely healthy looking to all of the sudden these symptoms. So it's, a really, really fast turn for the worst.
Yeah.
And that is the delayed onset or late vitamin K deficiency bleeding. Let's talk about how common it is. So this is without the vitamin K at birth. How common is vitamin K deficiency bleeding?
Mm-hmm. So we're looking at about somewhere between 4 and 7 babies out of 100,000. So this isn't very common. However, if it's your baby, you really don't care about the numbers and you're really concerned and scared. There are some I saw in Thailand, they actually had numbers that were more like 72 out of 100,000. And I'm not sure if that's a genetic issue or a gallbladder, because there's some issues with gallbladder diseases that can cause increased vitamin K1 issues. So it's without vitamin K, this is no vitamin K at all. You're looking at 4 to 7 babies in 100,000.
Per 100,000. And for a lot of us, that's not that big of a deal. It's so few when we look at vaccines. So when we're looking at vaccines and we say 4 to 7 babies who get, say, pertussis or who get a vaccine preventable disease, that's not to say that that is the mortality. So with delayed onset or with vitamin K deficiency bleeding, it's a very high mortality rate. So 4 to 7 in 100,000, that's quite high. So, just keep that in mind. And now that I mentioned vaccines, it's very important to say this. The vitamin K shot is not a vaccine. So people who purchase my vaccine strategy guide are often messaging in saying, where's the vitamin K shot? Well, that's not actually a vaccine. And the ingredients aren't as scary to parents as some of these ingredients in the vaccines. So I just wanted to note that the vitamin K shot is not actually a vaccine. Okay, so let's move on. Let's talk about, we were chatting about some of the controversies that are going around in the atmosphere, what parents are, wondering about with regards to vitamin K1. So do you want to speak to these?
Yeah, sure. So this is another thing that came up on social media quite a lot. So on the box of vitamin K that gets injected into your baby, there is a warning on that box that lists.
It is a black box warning. Yes.
Yes. Okay. So, and it is hypersensitivity reactions, and they can be potentially fatal. So any parent that comes across that is going to have a, oh, hell no moment, right? Like that is,
Yes.
What is going on here? So do you want to explain to them what that's all about?
Yes. So this black box warning is typically because of the ingredient, the polyoxylated castor oil. So that is what has been associated with rare hypersensitivity reactions. And problem with the vitamin K IV is because of this polyethylated castor oil. So that has happened in adults. So that black box warning is typically most often the IV form. Mm-hmm. And I think there was one single, the IM, the intramuscular, which is what we do at birth. There was one single case of the millions of doses that are given. There's been one single case of, was it death, Dr. Lydia?
It was a severe allergic reaction. I'm not sure if the baby died.
It was a severe allergic reaction to the IM dose. So I want to say that the black box warning is typically for the IV. Not typically. It is 99.99999% due to putting it parenterally or in an IV, not the IM at birth. So keep that in mind. But parents get very nervous when they hear about the black box warning on the vitamin K shot at birth. And now they're like, oh my gosh, I don't want to do it because there's this hypersensitivity reaction or even death. So I want to say, again, 99.99999%, it's the IV form that is of concern. And that is the IV form. If your child does suffer from vitamin K deficiency bleeding, they do IV form this vitamin K. They have to. So just keep that in mind. But that is why that they have that black box warning on there. So for me personally, I'm not concerned or worried about that black box warning as a mom or as a parent when I see that, because I know that my child is not receiving the IV form of vitamin K. They're receiving the IM form of vitamin K. And just to note, the vitamin K1 that we use here in the United States is phytonadione, is the active ingredient. It is one single injection that they do with the baby at birth. And there is a preservative-based vitamin K, and that includes benzyl alcohol. And that is very problematic for newborns. So for hypersensitivity reactions, it's rare, but it happens. So you want to opt for and make sure the hospital is dosing the preservative-free vitamin K shot. And the preservative-free brands that you can ask for, Pfizer makes one, the International Medications Systems, so IMS makes one, and Cipla USA. So those are 3 preservative-free vitamin K options that you can do. If you choose to do the vitamin K shot at birth, I can't stress enough to ask for the preservative-free version without that benzyl alcohol.
I think we should put those brand names in the show notes so parents know exactly what to ask for. That seems like a really good one. I know that's particularly important if you have a premature baby as well, as their lungs are not as mature.
Absolutely. And just to note as well, even if you have a premature baby, they still do the same amount. It's the same vitamin K shot. So they don't change the dosing on a premature baby. And I think that's why some parents start to look into this more, because they're like, wait a minute, why is my premature infant getting the same amount as a regular sized child at birth? And so that's why some parents look more into the oral vitamin K. So the oral vitamin K dosing, just as an aside. Okay. So when vitamin K, actually, we started dosing vitamin K shots in the 1960s. Dr. Lydia, do you want to talk about that?
Sure. So this is not new by any stretch of the imagination.
No.
So that's why we have decent safety data on this. So that you can sort of rest assured in a little bit more as well, that we have been tracking this for a long time. One of the controversies that came up in the early 90s, if you don't mind me speaking to it, because it may come up for some parents, was there was a discussion about vitamin K1 and leukemia. There were a few small studies out of northern Britain that showed an increased incidence. So they kind of looked back at children that had leukemia and kind of tracked backwards. But I want to also allay parents' fears about that. Since then, there has been extensive follow-up on it because naturally that was very concerning for public health reasons. And there's no link between leukemia and vitamin K1. So if you have given your baby vitamin K1 at birth and coming across this research and you're like, oh my goodness, did I just, put my child at risk for childhood leukemias? You did not. So I just want to throw that out there.
I'm so glad, because that is one of the controversies that I do see online, is that there is a correlation between vitamin K1 shot at birth and leukemia. And I have, gone through the research through thick and thin, and there's so much really great research that has come out, I think in 2019, that shows there is no correlation between vitamin K1 at birth and leukemia. And so thank you so much, Dr. Lydia, for bringing that up, because I absolutely totally forgot to mention that.
Yeah, they actually found slightly lower rates in the babies that were given vitamin K1. And it's not because deficiency causes leukemia. I'm not saying that. There's probably systemic barriers and et cetera that may be playing a role there. But I really don't want parents to be losing sleep over that one.
Yes. And so when parents choose to do, or they want to think about doing the oral vitamin K dosing versus the vitamin K shot, pretty much every other country in the world offers an oral dosing schedule. And I love Europe. They have all different dosing schedules. Canada has a different dosing schedule. So there's many different dosing schedules if you choose to do the oral dosing. And so on my USDA Organic Natal K, it's my oral vitamin K, I have take as directed by your healthcare professional. That's what I have on the suggested use, because there's so many ways to dose it, so many ways to Sunday to dose vitamin K1, that I just simply put take as prescribed by your healthcare provider. Now, I'll say, having said that, most parents who choose to do the oral dosing of vitamin K are going against the recommendation of their doctor. Their doctor's recommending the shot, and the parent is saying, but I want the oral dosing. So there are many studies of different ways of dosing, but the study to me that stands out the most incredible and credible is the study done by Denmark. So it was a Danish study. They followed 400,000 women, and it was a dosing schedule of 2 milligrams at birth of oral vitamin K, followed by 1 milligram weekly for the next 12 weeks. And that study showed 0 cases of vitamin K deficiency bleeding. So when your healthcare provider tells you that there's no substantiated evidence that the oral vitamin K works, they are full of baloney. Okay? So I just want to make that very clear, is that the Denmark study is the one that I most often used in my medical practice. That is the one that I use. Now, it is something that you have to remember. So when you're dosing your baby, you have to do it once a week for 12 weeks after the first day of birth. So some doctors will say that this is a compliance issue, why I do not recommend you do the oral vitamin K, because you're not going to remember to dose it. So the Denmark study that followed over 400,000 women showed that it was like almost every one of them gave at least 9 doses. So I love showing parents that study when it comes to vitamin K and dosing. I will say this. So I have a little story. It was like 2 weeks ago. A pediatrician wrote in to my customer service. She had purchased a couple bottles of vitamin K, my oral natal K. And she asked if separating that vitamin K out into plastic vials, if the vitamin K would still be stable in plastic. And we were like, absolutely yes. And my customer service tagged me in this. And I was like, why is she, taking 2 bottles and then putting them into a bunch of smaller plastic bottles anyway? So my vitamin K, the entire bottle is 30 mLs. And for the entire 12 weeks, you're only going to dose about 1 ml out of the 30 mLs. So you're going to 29 mLs you're going to throw away. And I'll just be fully transparent. The reason why I did that was because it was more expensive to manufacture a 10 ml bottle as opposed to the 30 ml. So anyway, this doctor was dosing out. She was going to dose out a bunch of these plastic bottles. Well, come to find out, she was going on a mission trip. And there are many women who are not birthing at the hospital in the country that she was going to because they would get deported back to their home country. And so I called her and I said, hey, let me just donate. How many bottles do you need? Let me just donate, because women were not birthing in the hospital, so they weren't getting the vitamin K shot. So she wanted to make sure that they were still getting the oral vitamin K version. And so when I called her, I said, let me donate these to you. We'll overnight them to you before you leave on this mission trip. And she told me roughly 36 bottles. And so I said, that's fine. I'll absolutely do it. And then she said, I feel like I'm going to the dark side. She's like, I can't believe I'm going to do oral vitamin K. I just can't believe this. Like, I'm totally going to the dark side. And she knew who she was talking to. I formulated the oral vitamin K. And so I simply replied, well, you know what? Instead of thinking like you're going to the dark side, how about you think like, I'm offering true informed consent. I'm offering to the patient true informed consent, whether they want to do the oral or they want to do the shot, because the oral proves to be just as effective when dosed correctly as the shot does.
Yeah, she's just going to Denmark, not the dark side.
She is using the Denmark study, but we did end up using one of the other studies because it is only 3 doses. And for compliance purposes, there is another dosing schedule where it's 2 milligrams at birth, followed by 2 milligrams between 4 and 6 days of life. And then again, another 2 milligrams around 6 weeks. So there's alternate dosing schedules, but that's the one that her and I decided she was going to use because for compliance purposes, these women who have many other fears that they're dealing with, they only have to abide by just those 3 doses. So anyway, I thought that was an interesting story and I wanted to share it with you all because pediatricians do believe they're doing wrong. They think that if they're not doing the shot, that the oral is highly ineffective. Well, it's not. It's just as effective if you dose it correctly. According to this Denmark study, again, almost 500,000 women, not a single case of delayed hemorrhagic. I still say that. I should say vitamin K deficiency bleeding.
Yeah, and because VKDB is so severe, it can be so severe, we're going to pay attention to that. We're like, what, people in Denmark are just going to be letting their babies bleed out and not be taking action against that. Like the oral drops are obviously doing fine, or there would be steps taken to introduce IM across the board.
Yeah, so I will say that Denmark does have the shot available now, but up until 1990, all they used was the oral vaccine, and with, tremendous efficacy. And so I am a huge, huge fan of the oral vitamin K at birth if you choose not to do the shot. And I feel like it's less potent, way less potent, because you're giving oral dosing over an extended period of time as opposed to one gigantic bolus of the IM shot. But it's just my medical and personal opinion. So either way is highly effective. It's just I want to give all of you options. I want to give you informed consent. So I want to give you all the options and then let you make a very educated and sound decision that is best for your family.
What do you think about the ingredients in the vitamin K IM injection compared to, say, vaccines? Because we have a lot of parents who kind of put them in the same boat.
Very clean. So very clean. My only beef with the vitamin K at birth is the large bolus that's given as a shot. So that's the only difference that I have. I'm not opposed to the preservative-free shot and the ingredients that are in it.
Okay, good for parents to know.
So when can you stop supplementing with oral vitamin K? Typically after 12 weeks of age is when you can stop. Or if you have never dosed with vitamin K. I do get this question a lot. Oh my gosh, I did not do the vitamin K shot at birth, and I totally forgot to do the oral drops, and my baby is 9 weeks old. What do I do? And I'll say, well, talk to your healthcare provider. But in my practice, I'll just go back to the dosing schedule, and I will just pick up where I left off with what I missed. And if after 12 weeks old, I would not dose anymore at all. So if you missed all 13 weeks, including birth, if you missed the oral dosing for all of those weeks, I don't say that you have to pick up dosing after age 12 weeks. And Dr. Lydia and I were discussing this prior to starting recording, that formula-fed babies, whether you dose oral vitamin K or not, formula-fed babies get an incredible amount of vitamin K in formula. And it is incredibly rare, if ever, there has been a vitamin K deficiency bleeding case in a formula-fed infant who has not received the vitamin K shot or done the oral vitamin K. So you have quite adequate vitamin K in formula if you are formula feeding your babe. I wanted to give that information. There are some clinicians, Dr. Lydia has here in the show notes, where they'll supplement up to age 6 months if baby is exclusively breastfed and has not received the vitamin K shot. So some doctors will dose vitamin K for a longer period, and it's totally fine. There's no, I've seen or heard of zero research regarding overdosing oral vitamin K. And I'll say this, I'm not going to oust my family member who did this, but I do have a family member who dosed, instead of micrograms, milligrams of vitamin K1 at birth, oral. Baby was just fine. That was when I went down rabbit holes upon rabbit holes of research, and we called poison control. And babe was perfectly fine. So even if you confused, don't do this, but if you confused micrograms for milligrams, babe will still be fine with the oral dosing. It is a very, very high safety profile. So if you accidentally, parents ask me this, oh my gosh, 3 drops got into babe's mouth instead of 2. What do I do? I'm terrified. Nothing. It's totally fine. So keep that in mind that, if you get a couple of extra drops in babe's mouth, if you choose the oral dosing regimen, that is completely safe. And let's talk about how to dose it. So When you dose vitamin K orally, you dose it after a feed for higher absorption purposes. You want to make sure that it's a fat soluble vitamin, so you want to take it with food. So after you do a breastfeed or formula feed, you will dose it. And if baby spits up within an hour, you dose again, just to make sure that baby gets an adequate amount of vitamin K. What else is down the pipeline? Oh, conversations.
Yeah, the talks, especially around circumcision, tongue ties, and just opting out. How do parents broach the conversation?
And Dr. Lydia put this in here about the conversation to have with the hospital. If you choose not to do the shot, what do you do? If you tell them, hey, look, I'm not doing the shot, I want to do the oral dosing, the hospital may not allow you to do the oral dosing in the hospital because it's a CYA. It is a liability. So I'm not saying that I did this with my first daughter or my first child, but the drops got snuck into her while I was in the hospital. So that is an option. I also highly, highly, highly recommend a birth plan. So you need to have this birth plan ready, complete, and handed to your OB or your midwife or whoever it is helping you to birth your babe. That information needs to be given to them prior to going into labor, prior to going to the hospital, prior to starting the birth process. So they should have a copy of your wishes in your birth plan. And in your birth plan needs to include, I am not doing the vitamin K shot at birth. I am doing the oral vitamin K. Here's the oral regimen that I'm doing, and here's the study that I'm going by. And I highly recommend you reference the Denmark study. Some people are like, what is a birth plan? Our next podcast episode is all things birth plan. Everything that you need to put in that birth plan for the hospital. So, and the legalities. And when the hospital receives a birth plan, especially with statutes from your state or laws from your state, they are very, very strict with what they will and won't do with your kid. And it's kind of amazing how they treat you. They treat you much better when you come armed with that birth plan that has your state laws included. Less likely to bully you. So I do get a lot of questions. The hospital's not going to allow me to bring this in. So if they're not going to let you and you're getting discharged on day 1 or discharged on day 2, you can start the oral dosing as soon as you get home. Or you can have that in your birth plan that is what you're doing. And if it's in your husband's pocket or if it's in your partner's pocket and babe gets dosed, that's an option too. It's my personal opinion. It is not my professional opinion that you do that. It is just what I did as a mom with my first child in the hospital. So let's chat. Dr. Lydia, she reached out to me yesterday, I think it was yesterday, about circumcision and tongue ties being released. Actually, I think it was this morning we chatted about it. Here's my thing with circumcision and tongue ties. It is up to the doctor performing these on whether or not you need the vitamin K shot or if they're okay with the oral vitamin K dosing. This is not up for discussion. It is what that doctor is willing to do. So we all, as physicians, carry liability insurance and what we feel comfortable with. And if I was a physician and you were a newborn and you wanted a circumcision and I did not feel comfortable to do the circumcision without the vitamin K shot, I'm going to say, no, I'm not doing the circumcision. So you need to find a doctor or specialist who will be okay with this. And so that's all I got to say is same with the tongue tie release. I will say the new laser tongue tie release is like very little bleeding, but there are doctors who are going to tell you, or dentists, I guess they're doing them now too. They will just tell you what their comfort level is. So it's completely up to them. And I will say as an aside, this podcast is not about circumcision, but since I mentioned it, if you do choose to circumcise your child, please, please, please find a surgeon to do this. I, in my medical practice over the past 15 years, have seen way too many botched circumcisions, mostly problems with adhesions, and very uncomfortable. It's very painful to your child. And just keep that in mind that it's very important to do your best to seek out, prior to giving birth, seek out a surgeon who is willing to, a pediatric surgeon who will do the circumcision. That's all I have to say about that. Yeah. So we talked about breastfeeding and formula feeding. Do you just want to sum that up?
Breast milk, not a great source of vitamin K1. Formula feeding, you basically will not find a baby who's deficient in vitamin K1.
Yes. So vitamin K deficiency bleeding, non-existent for formula-fed infants, even if you choose not to do the shot or the oral. And breast milk just does not have very much vitamin K. And so it's breastfed babies most specifically that may succumb to vitamin K deficiency bleeding if they don't have the shot or the oral version.
Correct. Yeah. We have a few kind of FAQs here if you are doing the oral dose, because, sometimes we forget, sometimes a baby spits up. So let's talk about troubleshooting. So if I forget a dose, what do I do?
Of the oral?
Yes.
Yeah. If you forget a dose, you just continue. So take that dose. Yeah. So like say babe did the first day of life, 2 milligrams, according to the Denmark study. Week 1, they got a milligram. Week 2, they got a milligram, and you forgot week 3 and you're going into week 4, give another milligram or give 2 milligrams. It doesn't have to be difficult to skip a dose and know what to do next. Is that this such a high safety profile vitamin K1 does that, double up the dose or talk to your doctor or skip the dose. I prefer to double up on the dose in my medical practice. Is like if you forgot to do it for 2 weeks, I recommend instead of 1 milligram to do 2 milligrams the following week. And when I say 1 milligram, it's 2 drops of my natal K. And when I say 2 milligrams, it's 4 drops. It's a super tiny amount.
So what if I'm a parent and I'm just forgetting every darn week and I think it's just better for me to do the injection? Can I
Absolutely
just go ahead and do that? Okay.
Yep. So reach out to your pediatrician, say, hey, look, I forgot to do the oral dosing schedule, or I just feel more comfortable now doing the IM. May I come in and do it? And the doctor will just schedule an appointment. You can come in and do it. So at any time you can change your mind for sure.
Perfect. And what about our little babies who just have GERD? They spit out after we dose them. What do we do?
If baby spits up within 1 hour after dosing, dose them again, is what I say. And it's not necessary that you do another feed. So we typically say dose this after a feed because it's a fat-soluble vitamin and we want it to absorb. But if you've done a feed, 20 minutes later, babe spits up, wait another 40 minutes and then dose again, is what I say. So just go ahead and dose again. Wait to make sure all the spit up is done. Typically, I say wait a little bit after the spit up because they may do it again. And then just dose it again.
Okay.
It's not difficult. I want this to be as seamless and as easy as possible. And I don't want parents to stress out when they're doing this oral dosing. And the problem is they don't have their doctors to call.
Yeah.
Because they've gone against their doctor's wishes. Instead of doing the IM, they've done the oral dosing. And I think this is absurd. Like the doctor's office, if you choose to do the oral dosing, the doctor's office needs to be there for you. And they're not. And so now parents are trying to figure out this on their own. And there's just not much information out there. I feel like until I came along to be able to start giving this information out to the public, because most midwives know this and they know the oral dosing schedule. And there are some doctors who choose the oral dosing schedule, but it's just not widely publicized oral dosing.
Yeah. And you're very good about not just selling the product, about providing different channels and avenues of support, whether it's customer service, whether it's our VIP group, our Facebook group. Like we can't provide medical direction, but we do provide a certain degree of support.
Yes. So after you purchase the vitamin K, the oral vitamin K, we have so many support options for you. If you're confused, just reach out to customer service. Like that's the best place. We do have emails that go out with all of the necessary information that you need after you purchase. But just in case you didn't receive that, if it went to your junk, and sometimes it does, my customer service is armed with all of the research and all of the information to give to you so that you can make a true, informed, and educated decision when it comes to vitamin K.
Yeah. We actually covered this one. If you give your infant an extra drop, parents do not need to be worried about fat-soluble vitamins getting toxic and all of that. There's a wide margin of safety.
No, Not for the vitamin K1 for sure. And so, yeah. Anything else, Dr. Lydia? This was so much information on vitamin K.
I think that was good. Like we do read your comments on YouTube and Spotify, etc. So, if there's something that you'd like to chime in with, please do. And we do our best to respond.
Yeah.
Yeah.
If you have questions or comments, please absolutely put them in the comment section with whatever you're listening to. And then I want you to be on the lookout for our next podcast episode, because we are going to be talking all about your birth plan. So we're going to be talking about vaccines at birth. We're going to be talking about erythromycin in the eyes. We're going to be talking about delayed cord clamping and bath. When should baby's first bath be? The hearing test, the heel stick. So lots and lots of really great information that we're going to be talking about. And that way you can make a really, really great birth plan that's most suitable for your own family.
Oh my gosh. I feel like that's half the battle with birthing. Just coming in there prepared. I think you get a different level of respect too when you're like, you know what? I have a clear idea of what I want here. Even if things go a little sideways, because birthing, can go any direction.
Yeah.
You still got an outline.
Yes, yes, yes. I recently said on a podcast with you, I believe, that pediatricians love when you come in armed with knowledge on what you do want to do. And I was completely being facetious. I was totally joking. Pediatricians absolutely probably hate it when you come in with your own information on what you do want to do. But there is a level of respect that doctors will have with you when you are knowledgeable about everything that they're discussing with you. And there's a much more respectful conversation that happens when you know what you want. And so if your birth plan is to a T what you want, and you have your state statutes there, what laws in your state, they treat you differently. And so, keep that in mind. And we look forward to seeing you on the next podcast.
Thank you so much. This was so helpful.
Yay. Thank you, Dr. Lydia. You all have an amazing, awesome day, and we'll talk soon.
Bye-bye.
Bye. I have so much more to talk about. So if you'd like to continue listening to this conversation, please join my VIP membership community. After signing up, you'll have access to my full-length episodes, my very lengthy library of parent-focused resources, including my treatment protocols, access to my parent support group, and exclusive product discounts. Join my community at drgreenmomvip.com. Thank you for listening, and I'll see you next time.